Assessment is the first stage in the nursing process. Assessment begins with the first observation of the patient. When you walk into the patient's room, you should complete a 60-second assessment, checking the environment for safety. Is the bed in the lowest position? Does the patient have their call bell within reach? Is the patient breathing? Are they alert and oriented? You'll then gather primary data from the patient during a patient interview. Secondary data is obtained from family members or from the chart. Subjective data are items that your patient tells you that you may or may not be able to verify. Objective data are things that you will obtain during your physical examination through laboratory results and diagnostic test results. Valuable information about the patient is collected during the interview, the health history, and the physical examination. Assessment proceeds in a logical and organized fashion to various degrees of depth during each patient-nurse interaction. The assessment phase of the nursing process includes much more than just collection of physical data. It does collect physical data, but also emotional, spiritual, socioeconomic, and cultural attributes that are unique to the individual are also considered. After data are collected, they must be analyzed, validated, organized, and documented to provide a foundation for individual patient-focused plan of care. The assessment begins with observation. A nurse can gather significant information about a patient's emotional condition and health status by observing the patient's affect, their clothing, personal hygiene, and other physical conditions. Before initiating the patient interview, the nurse should review data collected previously by other healthcare professionals to avoid repetition. The patient interview consists of 3 phases: the orientation or introductory phase, a working phase, and the termination phase. Each phase contributes to the development of trust and engagement between the nurse and the patient. The patient interview is a formal, structured discussion in which the nurse questions the patient to obtain demographic information, data about current health concerns, and medical and surgical histories. During the orientation phase of the interview, the nurse should establish the name by which the patient prefers to be addressed. This introductory phase is essential for establishing trust between the nurse and the patient, which affects all future interactions. The environment and timing of the interview are very important. It should be as private as possible and free from distractions. Health Insurance Portability and Accountability Act guidelines should be followed and privacy provided during patient interviews. Avoid negative and nonverbal cues. Educational needs are assessed during the patient interview. Interviews with patients that are already hospitalized or established in the healthcare system are less extensive and more focused on newly identified patients' concerns or problems. During the working phase of the patient interview, the nurse needs to stay focused and use active, engaged listening. Open-ended questions also are used to obtain data and information from the patient. A health history will be conducted by the nurse during the patient interview, which will contain the chief complaint or reason the patient is seeking health care, the history of current illness, allergies, medications and adverse reactions, medical history, family and social history, and health promotion practices. Thorough documentation of health history findings in the format prescribed by the healthcare facility contributes to better communication among healthcare team members and a more individualized plan of care. During the review of system interview, the nurse will be asking the patient questions about normal body functioning for each body system. Any deviation from normal triggers more directive questions and affects the physical exam that will be performed. After the collection of data, goals for care are established during the working phase in collaboration with the patient. During the termination phase, the nurse should summarize and validate information covered with the patient. By reviewing the information with the patient, a consensus is established on what the patient feels is important. The nurse should also include a review of the key findings that were found during this interview. In addition, the nurse should give an opportunity to the patient to add any other pertinent information that they feel is important. The session should conclude with the nurse acknowledging the patient's participation and also describe the next steps that the patient can expect. Patient education and health literacy. The nurse needs to assess the patient's cognitive ability, their reading level, and any potential language barriers. This assessment should include collecting data about what the patient already knows about their condition, as opposed to what additional knowledge is needed. Assessment information about the patient's educational needs to be documented in the patient's individualized plan of care. Thorough assessment of the patient's knowledge should be used to determine the need for referrals and educational interventions. On completion of the patient interview, health history, and review of symptoms, the nurse begins a physical assessment. If diagnostic tests such as blood or x-rays were ordered before the patient was seen, the results are reviewed by the nurse. Privacy for the patient is ensured, good lighting is established, and equipment and instruments needed such as stethoscope, blood pressure cuff, pulse oximeter, and pen light are gathered before the physical exam is started. Hand hygiene is performed and clean gloves are worn if contact with body fluids is anticipated. The nurse needs to announce themselves and also check the patient's ID with 2 patient identifiers. Vital signs are taken and recorded at the beginning of the physical examination. The assessment techniques of inspection, palpation, percussion, and auscultation are performed one at a time in this order for each body system, except during assessment of the abdomen. During abdominal assessment, auscultation precedes palpation and percussion. The alteration in the sequence of the abdominal assessment avoids stimulation of the bowel before the auscultation of the bowel sounds. Inspection involves the use of vision, hearing, and smell to closely scrutinize physical characteristics of a whole person and individualized body systems. Distinguishing between normal and abnormal findings for patients of different age groups begins the moment the nurse first observes and meets the individual and continues throughout the examination. Symmetry should be assessed by comparing the right and left sides of the body. Because the human body is usually anatomically symmetric, observing for abnormalities on both sides is important for detecting anatomic deviations. Palpation can determine organ location and size against expected anatomic norms. Any distension or masses and vibration or pulsation associated with movement. Palpation is used to affirm details observed during inspection. Only light palpation should be applied to areas described by patients as sensitive or painful. Deep palpation and percussion is performed by physicians and advanced practice nurses to determine organ size and variation. The characteristics of auscultated sounds depends on body tissues or organs being assessed. Breast sounds and heart sounds and bowel sounds are routinely assessed through auscultation. Practice is required to be able to differentiate normal from abnormal findings. Assessment is one of the most critical role requirements for the professional nurse. Nurses delegating assessments of vital signs must determine the stability of a patient and complexity of the problem before delegation. Verify that the unlicensed assistive personnel is trained and capable of accurately performing the skill. Collaborate with the UAP to confirm that the vital signs have been completed and properly documented. The registered nurse should also know that they should not delegate what they eat. They do not delegate evaluation, assessment, or teaching. Specific patient assessments may require the assistance of other healthcare team members. For example, determination of a patient's ability to swallow is commonly delegated to a speech therapist. Evaluation of patient's level of stability while using crutches is typically done by a physical therapist. A comprehensive assessment or complete assessment includes a thorough interview, health history, review of systems, and extensive head-to-toe physical exam, including evaluation of cranial nerves and sensory organs, such as sight and hearing testing. Comprehensive assessments often include a variety of laboratory and diagnostic tests that are ordered by the primary care provider. A focused assessment may be conducted when signs indicate a change in a patient's condition or the development of a new complication. This type of assessment is the most common type conducted by a nurse. Vital signs are assessed during each focused examination, which includes assessment of pain level and pulse oximetry readings. The nurse examines the head, the eyes, the ears, the nose, the throat, the neck, the thorax, including heart and lung sounds, the abdomen, including bowel sounds, and extremities. During a focused examination, edema, peripheral pulses, capillary refill, skin turgor, and muscle strength are routinely identified. Wounds, IV sites, supplemental oxygen level and delivery systems, NG tubes, cardiac monitoring, and urinary catheters are assessed and documented. While assessing the extremities, the nurse evaluates for edema, pulses, capillary refill, and strength. Intake and output levels are documented, as well as unique concerns for the patient at the time of the assessment. After completion of the basic head-to-toe assessment, attention turns to any health concerns raised by the patient. Emergency assessment is a physical exam done when time is a factor, when treatment must begin immediately, and priorities to care are established within a few seconds or minutes. Patient responsiveness is assessed in an attempt to establish the potential extent of injury to vital organs. Attention is paid to the patient's airway, breathing, and circulation. Other concerns in emergent settings are noticeable deformities, such as compound fractures, contusions or bruises, abrasions, puncture wounds, burns, tenderness, lacerations, bleeding, and swelling. During an emergency, the nurse may never have time to do a complete assessment and may work to stabilize one body system at a time. In this event, the nurse must remember to continually reassess every 5 to 15 minutes, depending on the stability of the patient. Triage, a form of emergency assessment, is the classification of patients according to treatment priority. Most emergency departments use a 3 or 5-tiered triage system. The trend is toward a 5-tiered system. The classification in a 3-tiered system are emergent, urgent, and non-urgent. The 5-tiered system classifies patients by level numbered 1 through 5. The triage nurse must remember that symptoms can change and ongoing reassessments are required. Triage is usually conducted when a patient enters the emergency department. The combined data are grouped using an established organizing framework and serve as a foundation for the patient-centered plan of care. Collecting data is a systematic process that must be ongoing throughout the nurse-patient interaction. Patients are the best source of information about their condition, feelings, and what they have done to address their concerns before seeking professional health care. In some cases, it's best to collect data from the patient before seeking information from secondary sources. If an adult patient is cognitively impaired or unconscious, or if the patient is an infant or a young child, subjective data about how the patient has been acting and feeling needs to be obtained from the patient's family or guardian. Verification of primary and secondary data is vitally important to avoid a plan of care based on inaccurate information. Primary caregivers and family members can be extremely helpful in providing valuable assessment data on the patients with disabilities. Subjective data are spoken information or symptoms that cannot be authenticated. Subjective data usually are gathered during an interview process if patients are well enough to describe their symptoms. Alert and oriented adults, patients, are the sources of primary subjective data. Family members, friends, and other members of the healthcare team can contribute to valid secondary subjective data. Subjective data should be documented as direct quotations. Objective data, also referred to as signs, can be measured or observed. The nurse's sense of sight, hearing, touch, smell are used to collect objective data. Objective assessment data are acquired through observation, physical examination, and analysis of laboratory and diagnostic test results. Sometimes during assessment of a patient, the nurse observes nonverbal cues that imply possible physical or emotional concerns. If a patient winces, it may indicate pain, or the patient resists being touched, the patient may be a victim of physical abuse. Crying and a disheveled appearance with lack of eye contact may be cues of depression. However, conclusions about the underlying cause of the patient's actions cannot be assumed. As patient information is collected, consistency between subjective and objective data must be confirmed. Confirming the validity of collected data often requires verbally checking with the patient to see whether assumptions or conclusions at which the nurse arrived are correct. Sometimes a nurse can use laboratory or diagnostic test results to validate subjective data. Learning how to think like a nurse is part of learning the nursing process, but it also involves the use of the critical thinking and development of clinical judgment. The nursing process, as you go through each step, the critical thinking process will consider the assessment information that you've gathered, identify issues in diagnosis, establish goals in the planning phase, take action in the implementation phase, and you'll evaluate the outcomes in the evaluation phase. Tanner's clinical judgment model also uses noticing what's going on with your patient, interpreting the findings, what's going on with your patient, accurately responding to the patient, and then reflecting on what you did to learn and improve your practice over time. Careful observation and attention to detail help the nurse to notice subtle clues and recognize how to validate and interpret patient data. Interpreting data and making inferences that determine patient care must involve ongoing interaction with patients and others, which include sensitivity to the patient's expectations, culture and ethnic traditions, and values. The nurse must know typical signs and symptoms of disease processes and which laboratory and diagnostic tests should be monitored on a basis for the patient's condition and medical diagnosis. There are several ways to organize your data that you've collected. Organization of data is important so that you can apply the nursing process, critical thinking, and clinical judgment as you develop a plan of care for your patient. In this nursing program, you'll be completing 2 functional dimension care plans this semester that will help you gather data, assess your patient, validate your findings, and organize your data that you've collected according to Gordon's functional dimensions. During this semester, you'll be using Gordon's functional dimensions to organize your data. This is an example of our functional dimension care plan that you'll be using in the program. It includes wellness, oxygenation, self-expression, mobility, skin and tissue, fluid balance, sleep, rest, and pain, nutrition, neurosensory, and elimination. All of these topics will be addressed during our nursing program this semester. Once you've assessed your patient, you'll be entering assessment information into each box of the Gordon's Functional Dimension Care Plan. The assessment will include normal as well as abnormal findings. You'll first list subjective findings, which could be something that your patient might say. If that is something they say, you're going to put that information in quotes. You'll also list your objective data. You'll list any medications that apply to each of the boxes, any laboratory values that would apply to that box, and any ordered medical treatments that would apply to that box. Any abnormal findings will be highlighted. And now we'll move to the next phase of the nursing process, the diagnosis phase.